is Shalisa. I am an L&D nurse. I am getting ready for my morning shift. I work 7 a.m. to 7 p.m., so a 12-hour shift. My morning routine is very basic: facial wash, oral hygiene, and eyeliner and eyelashes. I mean, no one sees your full face, so I feel like my eyes are the only thing that I accentuate. 5:29 in the morning, I am getting ready for my hot cocoa. I am not a coffee drinker at all. Like, if I drink coffee, it has to be a rough morning for me. Have my little shake going on, and I try to eat breakfast in the morning, oatmeal or waffles or taco before I get to work. Here I am pouring some almond milk in my hot cocoa. I love hot cocoa. Y'all, you are on your feet for 12 hours in a day. If you are not wearing compression socks, what are you doing with your life? Your feet would be swollen, sore, and whatnot. So here I have my preparations. Headed into work, clocking in at 6:45, which is our arrival time, to attend huddle and look at our assignments and talk about the day. I'm in the med room. This is our Pyxis, where we keep our medications, just to be proactive, to grab whatever medications you need. We have warm fluids, and also room temperature fluids. This is just an overlook of our medication room and what we have. IV kits. Also, we have our glucose monitors if our patient is diabetic. Labels to label your medications, your fluids, and IV tubings to connect your fluids and medications. We also have our narcotics that are locked up that we will have to get out of this Pyxis. This is our supply closet. Pretty basic and organized. Just come in there and grab what you need for our patients once we have them set and comfortable, and getting them ready for their induction. We also will keep our baby stuff in here too. This is the labor closet. This is a table for your preparation for a vaginal delivery. Now, you have your tech that can prepare it, but you as the labor nurse is also responsible of setting this table up if your tech is not available. And this is our labor bag. This is the nitrous machine. Some people are not aware that this is available as far as a medication if some moms are not ready to use IV meds or get an epidural. Yes, this is a labor tub. We do not use this because of sterile concerns. This is just a good overlook of my labor room. So I have my baby's crib, and also the warmer set up. You as a labor nurse is responsible to make sure everything is connected. Your ampu bag, your fluids for your patient, and everything is set up correctly temperature-wise for your baby. And here is my IV pump. I have my fluids collected. We use LR for our patients for hydration. And our monitor for blood pressures. And this is the labor bed. This is the bed that women will be delivering on. I have my toco and my ultrasound and my straps ready with my pulse ox. We also take women's urine samples just to check to make sure there's no infections. Also to see if there's any, if a mom comes in with possible concerns of drugs. Of course, we ask for permission, but we also need to check to make sure that there's nothing in their system. Here is the patient's closets and also the bathroom. Pretty basic. They also have a shower if they want to take a shower, which is totally okay. I am walking back to show you our OR room, which is where moms will come if they are getting ready to have a C-section. Get your shoes, get your hat, and this is one of our OR rooms. And here you can see we have everything prepared for emergency when a baby is delivered. The same thing as the vaginal room. We have our warmer set up. Here is the responsible for the nursery nurse. They will be in this room with you and ready to catch your baby. And this is the table that your tech will set up, not you, your tech, to prepare for the C-section. And here's our canister. We will always have it on a continuous for the doctor to be able to suction blood as they are opening up the mother. This is our machine and our grounding pads to keep the patient safe, of course. And you will put that on your patient. You are responsible for your patient being grounded. Here is the bed, the OR bed, where your patient will step up to get ready for their spinal. This black bag is to tilt the mother. We never want our mothers, our pregnant mothers, to be laying flat on their back. This area is the area for the anesthesia doctor or the CRNA who will be working with you closely with your patient. And so this is just what their area looks like from the back end. And as you see, we have our trash, our linen, and our biohazard bag in the room, and our lights. You will be preparing this room with your tech and your patient to be set up for preparation. This is our count bag. Our count bag is basically a label bag with where your labs will go, so you can get your QBL, which is quantity blood loss, for your patient to make sure your patient's not at risk for hemorrhage. This is just a closet of sutures. Sometimes your doctor is asking for more sutures or a different suture. You have to be ready to grab that. You are the circulating nurse in that operating room, so you are responsible for grabbing things that the doctor needs, that the tech needs, to make sure that this delivery is safe. This right here is a triage room. A triage room is basically a room where we assess a patient before we admit them to make sure that it's not a false alarm. We check them to see if they're ruptured, see if they are having blood pressure issues, and if so, we call the hospitalist or their primary doctor. And just like a labor room is set up, we have the monitors for the blood pressures, also the gels to check the baby, the toe cold ultrasound, and also sterile gloves to check their cervix to see if they are dilated. And we also have kits to check for them if they're ruptured. The bed is basically just set up to assess the baby while we are checking for their labs and other things to see if they need to be admitted. It's just an overview of the supply closet in the triage room to be ready for the patients that sometimes come in randomly, or sometimes they are sent in from their doctor's office because of possible rupture or contractions and dilation. So we try to be ready to get them set and ready for admission if so. Another thing you want to be sure is like when you have a patient that comes in and they don't have a primary physician, or you will call the hospitalist, which is usually someone who's already here, a labor and delivery nurse, labor and delivery doctor is always here. So you'll call them so they can place order ins so you can be able to proceed with the patient's care, the labor care. So always call the doctors to let them know when the patient is checking in so they can proceed with putting orders in and not delay the induction time. Okay, so my patient is here, but I also wanted to just pause for a moment and come and check my room again, make sure everything's set, and bring my Mobi Lab, which I have to print out my stickers after I start an IV, because you have to start an IV on your patient and get your blood work sit down so you can know the labs and stuff like that, because most patients want an epidural, so you gotta know those H&H levels and those platelets. So I'm gonna go ahead and get started. Make sure everything is facing forward. I love this thing, it's so cute. That about sums it up, guys. Thank you so much for coming to work with me. I love what I do as a labor nurse. It is very intense, hard work, but it is rewarding.